Hi, I'm Dr. Jeremy Walters, podiatric foot and ankle surgeon here at SMOC. Today I want to talk about a variation of an increasing procedure to fix Achilles tendon ruptures. So commonly, the Achilles tendon, which ruptures up in this area of the calf, creates a gap that we would traditionally repair end to end, like a severed rope. A newer procedure that's been around for coming on a decade or so is an Achilles SpeedBridge type procedure. Fun fact, Aaron Rodgers had this procedure done last year, which expedited his recovery and almost allowed him to return to play if they had made the playoffs. But essentially what happens is you repair the Achilles tendon with suture, and then you anchor it into the back of the heel bone, allowing for a stronger fixation and repair and harder ability for that to come undone in recovery. This takes the procedure from traditionally being on crutches for 8 to 12 weeks to allowing patients to walk in as little as 3 or 4 weeks and be back in a shoe in 6 weeks. This is a procedure we perform routinely at SMOC. If you have further questions, let us know.